If you've been told you have knee arthritis, you've probably heard some version of this line. Take some anti-inflammatories, try physical therapy. We can do a cortisone injection or a gel injection, and eventually, when the pain becomes more than you can bear, we'll replace your knee. But what if you're stuck somewhere in the middle? Your knee hurts, you've tried conservative treatments, you're having trouble walking, climbing stairs, golfing, exercise, or keeping up with your grandchildren. But you're not ready to replace your knee yet. Is there anything between conservative treatment and joint replacement? Well, for some patients, the answer may be yes. Today we're going to talk about bone marrow aspirate concentrate, or BMAC, and what the research actually tells us about using it for knee osteoarthritis. First, we need to change the way we think about osteoarthritis. Patients are often told your cartilage is worn out, but knee osteoarthritis is so much more complicated than that. It's a disease involving the entire joint, and yes, the cartilage changes, but so can the bone underneath the cartilage, the joint lining, the meniscus, the ligaments, the joint fluid, and even the muscles surrounding the knee. And as the disease progresses, inflammation inside the joint can contribute to pain and stiffness. That's one reason simply treating one part of the knee may not provide lasting relief. And there's another potential problem that I see all the time. Your knee hurts, so you stop walking as much. You stop exercising. Maybe you give up golf or pickleball. Maybe you stop taking the stairs. And that makes perfect sense because you're trying to avoid the pain. But gradually, the muscles around the knee get weaker. You could gain weight, your cardiovascular fitness declines, and now being active becomes even more difficult. So our goal isn't simply to make an X-ray look better. Our goal is to keep you moving because mobility is extremely important in maintaining your health and your independence as you age. So where does BMAC fit in? BMAC stands for bone marrow aspirate concentrate. We collect a relatively small amount of your own bone marrow from the back of your pelvis and process it during the same visit. The concentrate contains multiple components involved in your body's healing response, including platelets, growth factors, anti-inflammatory proteins, immune cells, and stem cells. But despite some of the advertising you may have seen, BMAC is not simply a stem cell injection. It's a complex biologic treatment. The idea is that these different cells and signaling proteins work together to influence inflammation and improve the environment inside the arthritic joint. So now let's address probably the biggest question that patients ask me. Will BMAC regrow the cartilage in my knee? The most accurate answer today is we don't know. There are laboratory and imaging studies suggesting BMAC may have beneficial effects on cartilage to potentially slow down the breakdown. But we do not have high-quality clinical evidence showing BMAC reliably grows large amounts of normal cartilage in an arthritic knee. And I think that's important for patients to hear. If someone guarantees you that a stem cell injection is going to regrow all the cartilage in your knee, the scientific evidence simply doesn't support that promise. But here's the important part. You don't necessarily have to regrow your cartilage to get dramatic, lasting relief. Because remember, osteoarthritis affects multiple structures in your joint. If we can decrease the pain, improve function, improve the environment inside the joint, and help you become more active again, that can be extremely meaningful for a long-term outcome. So what do the studies actually tell us? Over the past several years, multiple studies and systematic reviews have evaluated BMAC for knee osteoarthritis, and overall, the results have been encouraging. Studies have reported significant improvements in pain, walking ability, daily function, and quality of life. And with certain protocols, 80% of patients experienced meaningful improvement in their pain and function for many years, with some as long as 15 or more years. Recent randomized trials have also shown meaningful improvements in patients with moderate to severe knee arthritis. But there's another important point. Current research has not established that BMAC is clearly superior to every other orthobiologic treatment, including platelet-rich plasma or PRP in all cases. And that's important because not every patient with knee arthritis needs BMAC. I get this question all the time: which is better, PRP or BMAC? There isn't one answer for everyone. PRP has excellent evidence supporting its use in many patients with mild to moderate knee osteoarthritis. I may start thinking more seriously about BMAC when I see more advanced arthritis, more complex joint degeneration, bone marrow changes on the MRI, or a patient who hasn't responded adequately to the PRP. But I don't believe in automatically recommending the newest or most expensive treatment. Sometimes PRP makes sense. Sometimes bone marrow makes sense. And sometimes a knee replacement really is the right answer. The treatment needs to fit the patient, not the other way around. This is also why imaging can be so important. When I evaluate a painful knee, I'm not simply looking at how much cartilage is missing. I'm looking at the entire joint. Is there meniscus damage? Are the ligaments involved? What does the joint lining look like? And importantly, what's happening to the bone underneath the cartilage? Sometimes MRI shows areas of bone marrow edema, essentially areas of abnormal stress and inflammation within the bone itself. And that can be a very important pain generator. And if the painful pathology involves the bone underneath the joint, simply putting a biologic into the joint is not likely to relieve the pain. Treating the bone pain requires an advanced injection that greater than 95% of providers who inject biologics are not qualified to perform, and they're not even aware that this is an issue. At most of the big box regenerative medicine clinics that you see advertised on radio and TV, you would be lucky if they even want to look at your knee x-ray. At LifeStem, we have the training and experience to ask the right questions, order the right tests, and treat the structures that are actually generating the pain. There's another part of regenerative medicine that doesn't get nearly enough attention: the patient. At LifeStem, I tell patients, your body is your own pharmacy. If I'm creating your treatment from your own blood or bone marrow, then I care about the health of the person producing it. Blood sugar control, vitamin D, inflammation, nutrition, sleep, smoking, body weight, metabolic health, these all influence the quality of your bone marrow and your body's ability to heal. So optimizing the patient is part of optimizing the treatment. We're not just preparing your knee for BMAC, we're trying to optimize the pharmacy, meaning you, to produce the best treatment possible. So who might consider BMAC? Someone with persistent knee pain from osteoarthritis who has already tried reasonable conservative treatments, wants to remain active, and would like to delay knee replacement if that's medically appropriate. But BMAC isn't for everyone. If you have severe deformity, significant instability, loose bodies, or certain types of meniscus tears, knee surgery may still be the best outcome. And that's okay, because regenerative medicine shouldn't be about avoiding surgery at all costs. It should be about choosing the right treatment at the right stage of your disease. So can BMAC help you avoid a knee replacement? For some appropriately selected patients, BMAC may reduce pain, improve function, and potentially help delay or even avoid the need for a knee replacement. But that's not a miracle treatment. We can't promise to regrow your cartilage. We can't promise that you'll never need surgery. What we can do is carefully evaluate your knee, understand what's actually causing your pain, assess your overall health, review all of your options with you, and help you make an informed decision. At LifeStem, our philosophy is the right patient, the right biologic, the right place, at the right time. Because we all want to avoid having to get a knee replacement. But the bigger goal is to keep you active, independent, and doing the things you love for as long as possible. I'm Dr. Amy Adams with LifeStem Regenerative Medicine. If you're living with knee arthritis and wondering what options you have before knee replacement, we'd be happy to evaluate you and help you understand whether PRP, BMAC, surgery, or some other treatment makes the most sense for you.